Your sleep is killing your heart, and you have no idea it's happening. After 60, one wrong sleep habit can increase your heart attack risk by 83%. That's not aging, that's avoidable. 99% of seniors are making at least one of these five deadly mistakes every single night. And the worst part? You think you're doing everything right. In this video, we're exposing the 5 sleep habits that are silently destroying your heart after 60, ranked from dangerous to deadly. Stick around until the end because habit number 1 has been linked to a 91% higher risk of heart failure in seniors. But we'll also reveal the exact fixes that can reverse the damage in as little as 2 weeks. Before we dive in, quick question. Where are you watching from? Drop your city or country in the comments below. We're reading and replying to every single one. Now, here's what most doctors won't tell you. After 60, your heart doesn't recover from bad sleep the way it used to. Your blood vessels stiffen. Your blood pressure stays elevated longer. Your inflammation markers spike overnight. And when you combine that with the wrong sleep habits, you're not just tired the next day. You're setting yourself up for arrhythmias, strokes, and sudden cardiac events. The science is clear. Every study we reference is linked in the description below. This isn't guesswork. This is peer-reviewed research done on seniors just like you. Let's start with sleep habit number 5, the one that's quietly raising your blood pressure every single night. Dangerous habit number 5, sleeping less than 6 hours. Most seniors think they need less sleep as they age. That's a deadly myth. Your body needs 7 to 8 hours. Period. But here's what happens when you consistently sleep less than 6 hours after 60. Your sympathetic nervous system stays activated. That's your fight or flight mode. It never shuts off. Your heart rate stays elevated. Your blood pressure doesn't drop like it should at night. And your cortisol, the stress hormone, floods your system. Over time, this creates chronic inflammation in your arteries. That's the foundation for heart disease. A 2020 study in the Journal of the American Heart Association tracked 4,800 adults over 65. Those who slept less than 6 hours per night had a 48% higher risk of developing coronary artery disease. Another study from Harvard Medical School found that short sleep duration increased the risk of heart attack by 20% in seniors. But it gets worse. When you don't sleep enough, your body produces more ghrelin. That's the hunger hormone. You crave sugar and carbs the next day. Your blood sugar spikes. Your insulin resistance increases. And that puts even more strain on your heart. You're also more likely to skip exercise because you're exhausted. Your metabolism slows down. You gain weight around your belly. And that visceral fat releases inflammatory chemicals that attack your heart tissue directly. The fix: set a consistent bedtime that gives you 7.5 to 8 hours of sleep opportunity. Not just time in bed, time asleep. Turn off screens 60 minutes before bed. Keep your room cool, around 65 to 68 degrees Fahrenheit. And if you're waking up multiple times, talk to your doctor about sleep apnea. Screening, because interrupted sleep is just as dangerous as short sleep. And that brings us to habit number 4. Dangerous habit number 4, eating heavy meals within 3 hours of bedtime. You finish dinner at 7 p.m. You go to bed at 9 p.m. You think you're fine, but your heart is working overtime all night long. Here's why. When you eat a large meal, especially one high in fat, salt, or sugar, your body has to digest it. That requires blood flow. Your heart rate increases, your blood pressure rises, and your digestive system pulls blood away from other organs to process the food. For seniors, this is especially dangerous at night. A 2019 study in the European Heart Journal found that eating within 3 hours of bedtime increased the risk of nighttime hypertension by 34%. Nighttime hypertension is when your blood pressure doesn't drop during sleep like it should. It's called non-dipping, and it's one of the strongest predictors of heart attack and stroke in older adults. But there's more. Late-night eating also triggers acid reflux. That burning sensation in your chest isn't just uncomfortable. It can cause arrhythmias, irregular heartbeats that feel like fluttering or skipped beats. In severe cases, reflux can even mimic heart attack symptoms. And if you're eating salty foods before bed, you're retaining water. That increases blood volume. Your heart has to pump harder, and your kidneys, which are already slower after 60, can't keep up. The result? Swollen ankles, shortness of breath, and increased strain on your heart valves. The fix. Finish your last meal at least 3 to 4 hours before bedtime. If you're hungry later, have a small snack. A handful of almonds, a banana, or a small cup of plain yogurt. Avoid anything fried, spicy, or high in sodium, and never lie down immediately after eating. Stay upright for at least 30 minutes to let gravity help with digestion. Your heart will thank you. Now let's move to habit number 3. This one is shocking because most seniors think it's actually helping them sleep. Dangerous habit number 3. Using sleep medications regularly. Sleeping pills seem like the perfect solution. You can't sleep. You take a pill. Problem solved. But for seniors, these medications are a ticking time bomb for your heart. Most over-the-counter sleep aids contain diphenhydramine or doxylamine. These are antihistamines, and they have serious side effects after 60. They slow your heart rate, they lower your blood pressure too much, and they increase the risk of dangerous arrhythmias, especially atrial fibrillation. A 2021 study in the Journal of the American Geriatric Society found that seniors who use sleep medications regularly had a 44% higher risk of cardiovascular events. That includes heart attacks, strokes, and sudden cardiac death. Prescription sleep medications like benzodiazepines and Z drugs are even worse. They suppress your central nervous system. Your breathing slows down. Your oxygen levels drop during sleep. And if you already have sleep apnea, which many seniors do, these medications make it deadly. But here's what most people don't realize. Sleep medications don't give you real restorative sleep. They knock you out. But they suppress REM sleep and deep sleep, the stages where your heart recovers. So you wake up feeling groggy, not refreshed. Your heart never gets the repair time it needs. And over time, you become dependent on the medication just to fall asleep. The fix. Work with your doctor to taper off sleep medications slowly. Never stop cold turkey. Replace them with natural sleep hygiene practices. Magnesium glycinate 30 minutes before bed. A warm bath or shower to lower your core body temperature. Deep breathing exercises or progressive muscle relaxation. And if you still can't sleep, get evaluated for underlying issues like sleep apnea, restless leg syndrome, or anxiety. Fixing the root cause is always better than masking it with pills. But before we continue, if you've been enjoying this video so far, hit that like button. And don't forget to subscribe and turn on notifications so you don't miss more life-saving health tips like this. Now, let's move to habit number 2. This one is extremely common, and it's destroying your heart rhythm every single night. Dangerous habit number 2. Sleeping in a room that's too warm. You like your bedroom cozy and warm. Maybe you keep the heat on. Or you pile on heavy blankets. But here's the truth. A warm bedroom is terrible for your heart, especially after 60. Your body needs to cool down to fall into deep sleep. That's when your core temperature drops by about 1 to 2 degrees Fahrenheit. This cooling process triggers melatonin release. It slows your heart rate. It lowers your blood pressure. And it allows your cardiovascular system to enter recovery mode. But when your room is too warm, this process is disrupted. Your body can't cool down. Your heart rate stays elevated. Your blood pressure remains high. And you spend more time in light sleep instead of deep restorative sleep. A 2022 study published in Science of the Total Environment found that seniors who slept in rooms warmer than 70 degrees Fahrenheit had significantly higher nighttime heart rates. They also had more frequent episodes of atrial fibrillation. Another study from the National Institutes of Health showed that warm sleeping environments increased inflammation markers like C-reactive protein. That's a direct predictor of heart disease, but it's not just about heart rate. Warm rooms also cause dehydration. You sweat more during the night, your blood becomes thicker, and that increases the risk of blood clots, which can lead to strokes or pulmonary embolisms. For seniors already on blood thinners or with circulation issues, this is especially dangerous. The fix. Keep your bedroom between 60 and 67 degrees Fahrenheit. That's the ideal range for deep sleep and heart recovery. Use breathable cotton or linen sheets. Avoid synthetic fabrics that trap heat. If you get cold, wear light layers you can remove during the night. And consider a fan for air circulation. Moving air helps regulate body temperature and improves oxygen flow. Your heart will beat slower, steadier, and stronger. Now we've reached habit number 1, the most dangerous sleep habit for your heart after 60. This one has been directly linked to a 91% higher risk of heart failure. And most seniors have no idea they're doing it. Dangerous. Habit number 1, sleeping on your back with untreated sleep apnea. This is the silent killer. Sleep apnea is when you stop breathing repeatedly during the night. Your airway collapses, oxygen levels drop. Your brain panics and wakes you up just enough to breathe again. But you don't remember it. You think you slept through the night. Meanwhile, your heart is under attack. Every time you stop breathing, your oxygen saturation plummets. Your heart has to work harder to pump oxygenated blood to your organs. Your blood pressure spikes. Your heart rate becomes erratic. And over time, this causes permanent damage to your heart muscle. A landmark 2020 study in Circulation found that seniors with untreated sleep apnea had a 91% higher risk of heart failure. Another study from the Mayo Clinic showed that sleep apnea doubled the risk of sudden cardiac death during sleep. And here's the terrifying part. Over 80% of seniors with sleep apnea don't even know they have it. They think they're just snoring, or they blame their tiredness on age. But the damage is happening every single night. Sleep apnea also causes atrial fibrillation, the most common arrhythmia in older adults. It increases stroke risk by 500%. It leads to pulmonary hypertension, where the pressure in your lungs becomes dangerously high. And it accelerates cognitive decline because your brain isn't getting enough oxygen. Sleeping on your back makes it worse. Gravity pulls your tongue and soft tissues backward, blocking your airway even more. The fix: get tested for sleep apnea. Ask your doctor for a home sleep study or an in-lab polysomnography. If you're diagnosed, the gold standard treatment is CPAP, continuous positive airway pressure. It keeps your airway open all night. Your oxygen levels stay stable, your heart rate normalizes, and your risk of heart attack and stroke drops dramatically. Studies show that using CPAP for just 4 weeks can reduce blood pressure by 10 points. If CPAP isn't tolerable, there are alternatives. Oral appliances that reposition your jaw, positional therapy to keep you sleeping on your side, or in severe cases, surgical options. But the key is getting diagnosed and treated. Because untreated sleep apnea doesn't just make you tired. It kills your heart one night at a time. There you have it. The 5 sleep habits that are destroying your heart after 60. Sleeping less than 6 hours, eating heavy meals before bed, using sleep medications regularly, sleeping in a warm room, and sleeping on your back with untreated sleep apnea. Every one of these habits puts your heart under stress. But the good news? They're all fixable. You don't need expensive treatments or complicated protocols. You just need to make smarter choices starting tonight. Now we want to hear from you. Which of these habits shocked you the most? Are you guilty of any of them? Drop your answer in the comments below. We're reading and replying to every single one. And if this video helped you, hit that subscribe button right now. We're dropping new science-backed health tips for seniors every single week. Your heart deserves better. And now you know exactly how to protect it. Thanks for watching. We'll see you in the next one.